as always, I'll also talk about superconductors, but it looks like it's from I'll talk about superconductors as well. So my talk will focus on this while fermion realization does matter, or actually all of this, because there's no realization in physics, and topological superconductors, and how this helical topological superconductor, the idea could also be applied to white physics. In other words, is there a way to realize this white superconductor? So that sort of thing. So in topological superconductor, to make a connection from this wonderful talk, I will take the advantage of presenting topological superconductor first, so that conceptually there is a continuation, but then also it will make a way to connect to fermions in some way through topological insulators. So this is sort of my overview of my talk. So I'm not going to talk about topological insulator, but then these ideas, how these ideas have led to other related states of matter. Mostly I'll talk about, of course, helical pairing and bipolar stuff. This is sort of the broad overview, but I will try my best to make sure that you get a feel how matter are connected to topological insulators.
中国で生産された最新型の40種類の装備と100機近い航空機が披露され、負をアピールしました。一方、習近平では、
中国都永远不称霸，永远不搞扩张，永远不会把自身曾经经历过的悲惨遭遇强加给其他民族。
さらに兵力を30万人削減すると宣言し、平和路線を強調。日本やアメリカからの拡張の批判をかわす狙いも見られました。
それ嬉しいね。
And visualization, as you'll hear in a few minutes, but analytics. And this is a survey taken asking at what stage is your organization today in the deployment of analytics. And I've circled down at the bottom the word considering, that's the orange part. And I've circled life sciences and healthcare. And you'll see that a majority of companies in life science and healthcare are considering deploying analytics. Considering it. And then we go to the one where at what stage is your organization today in the deployment of analytics, and it's well below 10 or 15%. So there's a lot to be done. That's a lot of opportunity for all of you, and a lot of opportunity for new companies and also for development in research enterprises like universities and institutes. The final point I want to make is that who's going to pay for all this? And often it's the payers. I want to come back to that. The payers is the second largest segment in U.S. healthcare analytics, and if you could read the small print, it actually is the fastest growing and will be up to 40% of the purchasers of analytics capability and tools in the next few years. I've circled that part, but also providers and hospitals and the individual providers as well. So lots of opportunity in analytics. So with that, I'd like to turn it over first to Gaurav from Foundation Medicine to talk about how they're using big data and analytics in treatment.
So we're going to be here the last couple days and hear all of the excitement around not only data, but advances in information science, advances in statistics, advances in computation, and also a lot of the energy that's in the room around genomics and around cancer specifically. What I want to talk to you about today, as Brooke mentioned, is I want to talk to you about how we're using data at Foundation Medicine in the trenches, how physicians are using this data to inform patient care. So I work at Foundation Medicine. Foundation Medicine, as many of you may know, does genomic sequencing of patients. And so doctors send Foundation Medicine samples of their patients' tissues. We extract the DNA, sometimes the RNA, and from that extraction we sequence hundreds of genes. We look for any number of different alterations in that tumor. This comprehensive genomic profiling, which we've been doing now for a little over 5 years, has really changed the way cancer is managed. There's now a recognition that cancer is not just a disease of a specific tissue type, it's not just breast cancer or lung cancer, but the genomics that drive that cancer are instrumental in deciding how you treat that patient. There's also been an emergence of a lot of targeted therapies that target specific genomic drivers. And as we've done that over the last 5 years, we've sequenced thousands and thousands of genes. And we've built up a huge amount of knowledge about what different genomic profiles look like by different tumor types based on demographics. We've learned a lot about the science and curated information about literature, clinical trials, references, what drugs are associated with what tumor types. And in the process of doing that, we've collected what we call our Foundation Core, which is a set of databases that now consists of over 43,000 very high resolution, very high accuracy data points about cancer as it relates to genomics. And I think everybody in this here recognizes that a central foundation core, a central data set like this one, by far the largest of its kind, can be really impactful for a lot of folks. And we've been thinking about that for a while now for all of the constituents of the healthcare system. On the payer side, we've been thinking about economic analyses to understand how expensive drugs are being used appropriately or inappropriately and how we could optimize use of drugs that could be effective for cancer patients. On the regulatory side, we've been thinking about how we can improve accuracy and understand the accuracy of these complex tests. On the pharma side, we've done some really interesting things. Helped resurrect drugs that initially had stalled in clinical trials because the right population of patients wasn't selected. Now those drugs are available to patients who can really benefit from them. And what I want to talk to you about today, something close to my heart, is the physician and patient side of the equation. So I'm going to start with 2 examples. These are real cases that came across Foundation Medicine in the last few months. And these are doctors who called Foundation Medicine in the absence of a more robust technology solution. They called us and asked for guidance. And so the first was a physician who called about a patient of his who had a type of bladder cancer called urothelial carcinoma. And that patient had gotten Foundation Medicine testing and was found to have an amplification in a gene called FGFR. It was an unusual finding. The physician wasn't really sure what to do with it. And so called our medical affairs physician to talk a little bit more about the finding and what the data show. And it turned out, just by chance, the person who spoke to Foundation Medicine had previously talked to another physician in another part of the country who had seen a similar patient with a similar type of bladder cancer with the same FGFR3 mutation, who had actually been treated with a drug targeting FGFR3, and that patient had a dramatic response. So just by chance, just by sheer luck, that this physician had called Foundation Medicine, spoken to the one person at the company who knew about this other case, had this information to inform his treatment decision. It's happened other times too. Just in the last few months, there was a doctor who called about a patient with lung cancer, and a type of lung cancer called non-small cell lung cancer in an advanced stage. That patient was found to have an EGFR mutation. And certainly for the oncologists in the room and for others, you may know that EGFR is a well-characterized gene in advanced lung cancer, and there's great drugs for it. In fact, so good that they've now supplanted chemotherapy as first line in many cases. But the nuances here are important, and it's not just that this patient had lung cancer, not just that they had non-small cell lung cancer, not just that they had an EGFR mutation.